the internal limiting membrane and posterior hyaline membrane, as well as hemophthalmos, which occurred during the Valsalva maneuver, is accompanied by a sudden and painless decrease of vision. The condition is quite rare. Precise information of its epidemiology is lacking. Valsalva retinopathy occurs in somatically healthy patients after vomiting, lifting heavy objects, severe coughing, sneezing, fibrogastoscopy, and endotracheal anesthesia, and much more. Vitrectomy versus observation in this condition balances surgical risk and retina toxicity. Observation preferred if macula spared. When it comes to hemorrhage involving macula, observation can also be safe and effective for small hemorrhages with sizes up to 4 disc diameter. If the hemorrhage is larger than that, yak laser hyalurotomy or vitrectomy should be considered. In what cases laser treatment is preferable? It is possible if the hemorrhage is fresh. It also possible if the hemorrhage is high and size bigger than 4 disc diameter. We would like to present clinical case. A 36-year-old woman presented a sudden painless decrease in left eye vision 22 days after sneezing. This slide shows dynamics of best corrected visual acuity and macular OCT over 2 months of observation. During the last visit, ophthalmoscopy relieved yellow sheep foci in the fovea. These foveal lesions were visited on the macula as hyperreflective inclusions, causing retinal layers destruction. Therefore, the patient was offered vitrectomy. During the vitrectomy, it became clear that hemorrhage is located under ILM. ILM peeling was made, and yellowish deposit in the fovea area was removed by aspiration. After the manipulation, the macular hole was relieved. The edges of the hole were brought together by aspiration under PFCL. PFCL air exchange was performed. 7 days after surgery, visual acuity was 20/25. In degrees, 20/21 months after surgery. Another clinical case. A 36-year-old patient presented to our clinic complaining of a sudden decrease of vision in his right eye, which occurred during a coughing fit 1 day before. The following day, patient underwent yak laser hyalurotomy. After yak laser hyalurotomy, patient underwent macular OCT and fundus photography. 1 hour later, visometry showed visual acuity 20/25. 1 month after hyalurotomy, the patient's visual acuity 20/20. One more clinical case. A 30-year-old woman presented with decreased left eye vision 1 day after intense physical activity. Ophthalmoscopy relieved a 14 disc diameter macular hemorrhage. We decided to perform laser hyalurotomy. 1 day after surgery, visual acuity was 2400. The patient was decreased for observation. 25 days after hyalurotomy, patients returned with visual acuity decrease to light perception. Ophthalmoscopy relieved intense floating opacities through the whole vitreous. A decision was made to perform vitrectomy. The video demonstrates dense hemophthalmos during vitrectomy with high risk of damage of posterior capsule. And damage happened a month after vitrectomy. The patient returned for checkup. Visual acuity was 20/20. According on the OCT data, we see a traumatic cataract in the inferior part of the lens. What should we do when Valsalva retinopathy occurs? Treat or observe. Any response can be suitable if treatment accounts the hemorrhage duration, location, and size. Also, when choosing treatment strategy, we need to remember that then patients are mostly young and need to return to work quickly. So early surgery can be a good option as long as the patient understands the risks. Thank you.
Thank you. A nice collection of cases. Thank you so much. Two questions actually, just out of interest. The first case, the patient had a macular hole. No, it didn't have a macular hole, right?
Damage in inner layers when we aspirated yellowfish fauci, we make damage inner layers.
In the layers, okay.
Yeah.
All right. And the last case, the cataract happened during the vitrectomy with
Yes.
the lens touch, right?
Yes.
Yes, you're right. So I think it's a good point when they have this hemorrhage at the back of the lens. Then, in anticipation, one needs to know that there is a risk of hitting the lens while clearing
High
that.
risk, yes.
Yes. Great cases. Thank you so much.
Thank you.